let's get to the big story this evening. So now we know some things for sure, that we are in the middle of a COVID second wave. There is little doubt of that. It's going beyond the initial few states and spreading a little wider, but it's still restricted to 5 or 6 states. The epicenter is undoubtedly Maharashtra, but see how the numbers have also been spiking. We have close to 40,000 cases all India, which have been clocked as of yesterday. Maharashtra again for the second day with 25,000 cases, and Mumbai with over 3,000 cases. I'm talking about new daily cases, not the overall cases. Now, how do you deal with it is the question. Various authorities are putting in specific restrictions. So, for example, the government of Madhya Pradesh announced earlier this evening that they would have a one-day lockdown on Sunday in a few cities, including Indore and Jabalpur, and that schools and colleges would only be online for some more time till the end of this month. One proposal that has come to the fore is in Mumbai, where the local authorities, the BMC, says that they want malls to have customers coming in only after they show a negative RT-PCR test, which has a 72-hour validity. If someone doesn't have that negative test, then they need to come in and actually take a rapid antigen test on the spot. Now imagine that, because a rapid antigen test from end to end will take 30 to 45 minutes. Imagine the queues outside the mall waiting for that to happen, if anyone turns up at all to put themselves through that trouble. So that's the big question coming in right now. In fact, we're learning that mall owners are now pushing back. So we'll see where that story goes. Meanwhile, Utkarsh Chaturvedi joining me with all the latest today on that story.
So by evening, you will get a new further notification, Alex. And what that notification will tell you is the fact that you might have to go or undergo a compulsory antigen test at least to enter the malls. There will be other notifications coming in for railway stations as well. At least at this point of time, the new notification which came a few hours ago spoke about the fact that how at theaters you have to be at a 50% attendance. Drama, schools and all of that, you need to be at a 50% attendance. What we're waiting for is the bigger announcement. What we're waiting for is the bigger, the bigger notification which has been spoken to by BMC to us. And what we're expecting is that from Monday, if you're really entering a mall, it might be a mall in the restaurant, so the restaurant as well, you might have to go to an antigen test. That's a bigger worry at this point of time for Mumbaikars, because that will really restrict a lot of movement, because it will take a lot of time. That is very discouraging a lot of people to go out and move, and further restrictions can also come if the numbers continue to go the way they are.
So how is this going to impact malls? How is this going to impact restaurants? Remember, restaurants have to now enforce the 50% cap, and there are stringent rules in place. There are reports of some restaurants that have been pulled up and served notices by the BMC. And is this really going to be enough? Now, we have to maintain a balance here between really choking in the numbers, closing in the numbers, and making sure we don't choke industry as well. So we're going to have that debate today. Dr. Shashank Joshi joins us on the show, as does Anurag Katriar, president of NRAI, and Mukesh Kumar, CEO of Infiniti Malls. Let me go to Mukesh Kumar first. Mr. Kumar, so now we're hearing that they could possibly have this rule that you have to have a negative COVID-19 test, an RT-PCR test with a validity of 72 hours before entering into a mall. And if that's not there, then you have to administer these rapid antigen tests, and only then people can come in. Will this be feasible? Is this doable?
I think it's very, very impractical to have something like this. If you are talking about a few hundreds, it's still fine. You're talking about getting people in a few thousand. So you need, let's say, 4,000, 5,000, 10,000 people coming in a day or on a weekend. How are you going to manage that? Number two, when you talk about antigen test, it takes 30 to 40 minutes to get your result also. Are you expecting the customers to wait also with 30, 40 minutes? Is that really feasible or practical? Why would somebody come to the mall in case something like this is really made mandatory? I understand the retail staff, yes, they can go through this. That's what we are proposing, in fact, to the government, that we'll be happy to do it for the retail staff once in 15 days or once in 3 weeks. But for the visitors to do this, I think it's totally impractical. I don't think it's going to happen at all. I mean, it's something which we can't even think of. How do you tell a customer when you're coming to the mall, you have to go through antigen test or RT-PCR test? I mean, is that really practical? Is that possible?
How really will you do this? I'm wondering about the actual nuts and bolts of it. If you have to administer these antigen tests, won't this lead to a large crowd outside of people waiting if it's 30 to 45 minutes each? Forget that. Will people actually want to come and wait outside the mall and take these tests? Do you think it will desist people from even coming?
It'll discourage people to coming to the mall, because why would somebody come and wait for half an hour to get his test done? Unless it is mandatory that he has to get a test done for something, some other purpose. But come to visit the mall to get a test done, I don't think it's really practical. And anybody's going to come and go to do the test, because there's nothing it's not essential service. Coming to the mall is not very essential. People come to, do shopping, eating out, entertainment. It's not mandatory. It's not really need-based. They have to come to the mall. But you're making things like this, you're making it very difficult for customers to come to the mall. So I don't think it's really practical. Let's see how it's going to pan out. First of all, I hope it doesn't really happen. But it happens, it's going to be a big blow to the industry, to the malls. And, we are just limping back to normalcy. And suddenly something like this that happens, despite we following all the protocols. Please understand, whatever we have done so far in the mall, it has all been decided by the government, by the health ministry. We have discussed all the SOPs, threadbare with everybody else. We've taken everybody's input. Then we have done this. In fact, in the meeting that happened last week at the Chief Minister's office, they suggested a few more things to improve, like adding more marshals. We already have marshals. So why don't you add more? So we have done that as well. So what has been asked, we have been following everything. So something like this that, you expecting a customer to go through antigen test or RT-PCR, I don't really think it's practical at all.
Yeah, so the mall owners are fighting back as of now. Stay with us, Mukesh Kumar, while we get more clarity on this. Let me go across to Anurag Katriar to get some insight. Mr. Katriar, are you seeing footfalls already coming down, considering that people will be now uncertain, right? As cases are going up, people also would hopefully be a bit fearful and more careful. Are you seeing that impact on business already? And these reiteration of rules of 50% capacity, how is that working out?
Hi, Tamanna. Yeah, I mean, the numbers are already showing a little bit of a downward trend for last 3-4 days ever since the cases started going up. And, it is not very surprising. When something like this happens, when the caseload goes up to all-time high, the sentiments will be impacted to a certain degree, despite, all the safety measures which are in place at the restaurants and the general safety upkeep that people are keeping. Coming to the other thing about 50%, I think that rule was never relaxed. It is working well, to be honest. It is, I would love to have a 75% capacity if you had asked me a week back. But looking at the caseload, I think 50% is just right. Reiteration is good, because there could be a few people who are not following the COVID norms, and it's better that everybody follows the COVID norm, because indiscretion by a few could actually hurt the entire sector. We don't want another lockdown. We can't afford another lockdown. So I think this 50% is fine. Consumer sentiments are anyway low. So I think we should be propagating safe dining than, actually scaring people that going out is bad. We should be propagating more of safety measures than anything else.
This is where the conundrum is, Dr. Joshi. On the one hand, the fact is that the more people go out, the more the COVID-19 will spread. And you're already seeing that. On the other hand, you don't want to kill the businesses which are just about reviving themselves. And how do you do that? Do you think that malls, restaurants and service industry is going to get hit now for some time? It's inevitable?
Mala, I think it's absolutely inevitable, because whether you like it or not, we are into a big problem. We are on a red zone. We are not in orange zone or in yellow zone anymore. And our numbers have crossed all limits now. Yesterday and today, we have crossed all records. So, and it's a very rapidly spreading strain in clusters. So I think, let's not get digressed into issues related to this antigen testing or mall footfalls, etc. I think that's a very, very, for us, from a public health standpoint, we need to aggressively test. And I agree with Anurag that, we need to look at safety protocols in place. if we need to continue our current working, we need to have a zero tolerance for violators. That's number one. And I think the Honorable CM was very kind with all of them and told them that you all self-regulate yourselves. I think it's like your own responsibility. You take your own responsibility. If there are black sheep within your own family, take care of them. And I think that's the right way. And that was a very prudent, pragmatic approach he took last week. It was last Saturday, if I'm not mistaken, that meeting took place.
Yes.
And I think it was a very gentle suggestion by him that take care, because he exactly knew, and we all knew, that we are headed for a very exponential rise of cases. Probably the mall owners were not that aware that the numbers would explode that quick and fast. We are looking at a fast spreading strain, probably a different strain. And it's really, we are in the second wave. So if somebody is saying from the government that we are not in the second wave, at least in Maharashtra and Mumbai, we are. Today we have crossed 3,000 numbers. We are at almost more than 10% test positivity rate. So we clearly are there. So we need safety first. And I think as long as COVID appropriate protocols are done, we need to increase up our testing frequency.
Yeah.
And for increasing the testing frequency, we need to do random sampling. We just know, I think malls are not the only thing we need to target. We need to target bus stations. We need to target train stations. We need to target, and these places, the big bazaars, and all these places, we need to do random sampling to see what is the positivity rate. Now, one thing which has been clearly noticed, Tamanna, is that the less exposed people are the ones who are getting the COVID virus. And probably one of the reasons the BMC has thought of the malls and of a strategy to contain that place, and that's a public health strategy to contain that place, is probably they are feeling that these are the people who are going into a safer environment, and they feel mall is a safer environment. I think they need to do their own crowd control, they need to self-regulate, but I think we are in a clear red zone, and we need to do more testing. We need to mask mandatorily. If we are in a crowded environment, we need to double mask. We need to ensure that the air ventilation, I would rather focus in the mall on the air ventilation, on HEPA filters, on safe dining protocols, on unmasking protocols. They are far more relevant, and I think they have tried their best. But I do agree to some extent that some of that might have been faltered in the last month and a half. Because, in overzealous enthusiasm, you do get some black sheep. But I agree that, currently there is no scope for all this discussion, Tamanna. We need to, on a war footing, now dent this wave and get back to normalcy in 6 weeks. If we continue the way at which these numbers are going, we are going to go to a grounded halt. And whether the word lockdown may not use, but we'll use the word micro-containment. So micro-containment and macro-containment or lockdown can be used interchangeably. It is like, previously government said there's no community transmission. Till that they have not agreed that there was community transmission. But we know there's community transmission. Similarly, there will be micro-containment as a word which is used. And that is a very nice way of saying that everything is contained in a small zone. But that's not a solution. I think we need to go move. We need to tell people, educate people, to tell them that mask, be responsible, be careful, be safe. And I think that message has to go universally. And I think malls actually are good places to do good public health education. There can be voluntary testing there. There could be random sampling there. Those are strategies to be done. And I'm certain that could be done, because this is something which we need to do on a war footing. But I think right now we are inundated with the corona pandemic in a big way in Maharashtra and Mumbai. And if we want to prevent any further deterioration, we need to put a full stop somewhere. And for that, I think the first thing is zero tolerance for violation of COVID appropriate protocols.
Yeah, I really agree with this point about why just malls. We need to look at this beyond malls, beyond restaurants. But the fact is that these are which are going to be hit. I'm not just talking about malls and restaurants, all service sector, your salons, your travel and tourism, everything which was beginning to pick up slowly is now going to get a sucker punch right now. Mr. Mukesh Kumar, if there is an ultimatum about this rapid antigen test, it's still up there in the air, and malls are saying that, listen, we cannot really implement this. The government is mulling it, the BMC is mulling it. If there's an ultimatum that do the test or you will have to shut, what will you do then?
Do we have a choice? Do we have a choice? We have not really thought of those lines. We are trying to make an attempt reaching out to the government and trying to request, okay, we will do something, take a middle path, maybe do an ad hoc kind of testing and have a setup at the mall. Do ad hoc testing and at random testing, and we'll be happy to do for the retail staff and the mall staff, maybe once in 2 weeks, once in 3 weeks. We'll be happy to cooperate and make sure that people go through this. But for the visitors to do this is going to be very, very difficult. So I'm hoping that, we'll be able to reach out to the government, have a dialogue with them and see we can, not make it so difficult.
Yeah. Anurag, here it's not just about black sheep and restaurants, but will you agree that really caution had been thrown to the wind by quite a few, not just restaurants, but people in the service sector and people at large? I would say a month ago, it seemed like COVID-19 never existed. And now we find ourselves in this situation. How do you think you can navigate this going forward as a business owner?
First of all, I think even in the last meeting we had with the Honorable CM of Maharashtra on Saturday, we agreed probably, very minuscule percent, maybe 8-10% of the restaurants are so-called black sheep who are not following the COVID protocol. And the rest of the fraternity is following it. Now, what the government has done, my contention was very clear, that penalize those who are not following the protocols, but don't shut down the sector. And that's exactly what the last circular says. It says that if they find anybody violating, then they're going to shut down that place as long as the Epidemic Act is in place. Now, that's a huge deterrent. And I think at the same time, let me make another point, Tamanna. I think to ensure safe dining is a joint responsibility of the restaurants, the government, and the guest. We are leaving out that part. One of the things that we have been talking about is you are supposed to take off your mask at the restaurant only while you are eating or drinking, not during your entire duration of stay at the restaurant. And I think these are the things. If everybody starts getting, serious and responsible about their responsibilities as citizens, as businesses, as government, I think we can still tackle it. It is still doable. It will be tough. The sentiments will be low. Business will go down. But we are equal partners with the government in fighting the pandemic, and we'll do whatever it takes as long as, it's practical and helps us. I would rather go through 6 weeks of hardships for a brighter future than be very adventurous right now and not follow the protocols. I think in a nutshell, I believe it is our joint responsibility equally between the government, the businesses and the guests. And everyone should play their role well. If everybody plays their role well, we will all be soon out of it.
Yeah. Dr. Joshi, going ahead, do you see the need for more restrictions than they are right now? Because, some of these points are vague. I'm not sure how people are really going to implement it. For example, in a restaurant, you have to eat when you're, remove your mask when you're eating or drinking. What about while you're waiting for your food? What if you're talking to someone between bites? I mean, it's all very vague. And we've also seen a situation where those that are tasked with enforcing have a lot of arbitrary powers right now. We are going to unfortunately come to a stage where there is a bit of heavy-handed and very discretionary action against common citizens. And that is going to lead to more problems. How do we avoid that?
Again, this is not my domain, but I can only tell you one thing, that we are in serious trouble as far as COVID is concerned. And I think we have to, I agree with Anurag completely, that we need to come as one Maharashtra, one Mumbai, and fight this pandemic responsibly, behave responsibly and stay safe. And I think each person who is there as an actor in the stage, whether it is the guest, whether it is the person, whether it is the owner, whether it is the person inside, everybody needs to stay safe. I think the waiters there are equally, putting their lives to risk, and I think that's not fair to them either if the guests behave irresponsibly. And I think if somebody is a carrier, super spreader, silent spreader, we don't know. So I think what I feel right now is a larger problem is in the next 2 to 3 weeks are going to be make and break weeks for Mumbai, Maharashtra and India. And we will have to be extremely vigilant. And if we are not vigilant and we don't have zero tolerance for protocols, we are heading for a doomsday. Now, whether you call it micro-containment or a lockdown, I think we will come to a grounding halt. Already you see Nagpur and Vidarbha is almost halted out. Already you are seeing that parts of Aurangabad and Marathwada are almost halted out. We are seeing Jalgaon almost red. We are seeing Nasik in a big limbo but partially working. Mumbai is still virtually vibrant and alive. But you will see, and I'm sure my worthy colleague will agree that there is definitely a consumer sentiment coming down. And, we'll split down further. I think if we just proactively, in these 2 to 4 weeks, behave responsibly, I think we can still stem these numbers. These numbers are crazy. We need to get and encourage citizens' cooperation. We need to make them more responsible. They just can't be so careless. I think this vaccine also has, they have to have false sense of security. They think now there is a vaccine, the death rate is very low. Abhi kuch nahi hoega, hum log jayega. That is a very wrong attitude. I want to appeal through a channel that please, Corona is very much here. Throughout 2021, you need to mask. Throughout 2021, whether you had COVID, whether you have antibody, whether you have 1 dose or 2 doses of vaccine, you still need to mask. And you still need to behave responsibly. Otherwise, we will pay the price. And there are people who have died of COVID, they continue dying of COVID. And they still get maimed. There are people who have had ventilators, people whose lungs are crippled. They still can't breathe well. They need oxygen at night. Even today, who have recovered from COVID 1 year back. And I think it's important that everybody cooperates. And I think everyone will cooperate. I think we have risen to occasions in times of floods, in times of disasters. And I know fatigue has set in, but we all need to rise up to the occasion. And we need to have a safer place around it. You see, COVID is going to keep coming back.
Well, it's going to be a tough time going ahead, and we have to keep that very, very close balance between not letting us slide back into a situation where we found ourselves a year ago. We have learned lessons. Picking up vaccination is one of the ways to go ahead as well, and maybe it's time to work on that, as we have been saying consistently. Thank you so much to all of you for joining us on the big discussion this evening. I also want to point out the kind of impact the last 1 year and COVID-19 has had on people in this country. And this is some very important data that has come out by Pew Research, which shows that 32 million, so over 3 crore Indians were pushed out of middle class and into poverty last year because of COVID-19. In fact, the number of people as defined as those in poverty has gone up by over 75 million in the last 1 year. So you can imagine, while high income groups have seen a negligible change in their numbers. So if you compare ourselves to China, the income distribution has changed in a moderate manner, while poverty in China has seen an increase by only 1 million people. There is also a comparative small decrease in the middle income group. So you're very clearly saying that while the rich have gotten richer, because there's a list of billionaires the world over who have actually done very well, in part because of COVID-19 and changing behaviors, there are those who have gotten so much poorer. Really food for thought there. We'll take a very short break, but stay with us. India Revival Mission up next.